Hello, hello. My name is Dr. Aubrey Johnson. I recently graduated from Virginia Tech with my Doctor of Philosophy in Clinical Physiology and Metabolism. And currently, I'm on a really cool adventure of being a high school math teacher at the local high school. Well, it's not really local, it's like 30 minutes away, but I'm having a really good time. But in my free time, I continue to engage in research in the field of exercise physiology. So I thought it was cool when Dr. Williams informed me of the opportunity to share research with you guys. And I love trying out exploring, like doing research in the field of chronic disease. And mental health is really important to me, and research is emerging that exercise can help from a neurological standpoint in improving mental health disorders. So today I decided to look at bipolar disorder in particular. Bipolar disorder is a chronic neurobiological condition that affects approximately 1 to 4% of the global population. So we're going to explore the clinical features of the disorder in today's lecture. We'll also explore the relevant neurobiological mechanisms and emerging evidence surrounding the role of exercise as an adjunctive treatment. So, adjunctive just means alongside psychiatric medication or counseling, so on and so forth. While exercise is often considered beneficial for mental health in general, in bipolar disorder, it can sometimes help and sometimes cause harm. So, the goal of this lecture is to explore why that's the case by examining the clinical features of bipolar disorder, the underlying neurobiology, and what research evidence tells us about exercise as an adjunctive treatment. So, thank you for your attention, and I hope that you not only learn something new from the math teacher, but I also feel encouraged to ask questions and engage with the material as we move forward. So, for learning objectives, by the end of this lecture, you should be able to describe the basic characteristics of bipolar disorder, including key mood states involved. You should also understand some of the major neurobiological processes that contribute to the disorder. We will then focus on why exercise has both benefits and risks for people with bipolar disorder and what research studies show when exercise is tested as part of treatment. And then finally, you should be able to explain general principles for using exercise safely and appropriately in individuals with bipolar disorder. So we're just dipping our toe in the world of bipolar disorder. There are so many neurological processes that we could dive further into. There's so many more specifics of exercise, but I just like to give you guys a bird's eye view of what's going on in the body. So bipolar is So, bipolar disorder is a chronic mood disorder characterized by significant fluctuations in mood, energy, and activity levels. These mood changes are not random. They occur in the form of episodes that range from depression to hypomania or mania. And between these episodes, individuals may experience periods of relative emotional stability, known as euthymia. Importantly, bipolar disorder is not simply about being happy one day and sad the next. The mood changes are intense, sustained, and very disruptive, and they reflect underlying changes in brain function rather than normal emotional variation. So, mania and hypomania are related, but they differ in severity and clinical impact. Mania involves a sustained period of at least 1 week of elevated or irritable mood combined with increased energy and activity. Individuals in this situation may sleep very little, feel unusually confident or grandiose, engage in risky behaviors, and experience racing thoughts. Mania often requires hospitalization because judgment and safety can be seriously compromised. Hypomania involves similar symptoms, but they last for at least 4 days and are less severe. People with hypomania may still function in daily life, which can make it harder to recognize and diagnose. So there are two types of bipolar 1 and bipolar 2. Bipolar 1 disorder is defined by the presence of at least one manic episode. Although depressive episodes are common in bipolar 1, they are not required for diagnosis. Bipolar 2 disorder, on the other hand, requires at least one hypomanic episode and at least one major depressive episode, but there is no history of full mania. Bipolar 2 is frequently misdiagnosed as major depressive disorder because hypomanic symptoms are often overlooked or misinterpreted as periods of productivity or high energy. Bipolar disorder is often progressive, meaning that without appropriate treatment, episodes can become more frequent, more severe, and more difficult to treat over time. Repeated mood episodes are associated with worsening psychosocial functioning, cognitive difficulties, and increased suicide risk. This pattern has led researchers to consider bipolar disorder not just as a series of discrete episodes, but as an illness that can gradually change brain function if left untreated. Understanding the biology of bipolar disorder helps explain why it behaves the way it does clinically. Bipolar disorder has a strong biological basis involving genetic vulnerability, neurotransmitter systems, and structural and functional changes in the brain. These biological factors influence not only mood states, but also how individuals respond to treatments. When we later discuss exercise, it becomes clear that exercise interacts with many of the same biological systems involved in bipolar disorder, which explains both its potential benefits and its risks. The concept of neuroprogression suggests that repeated mood episodes may lead to cumulative changes in the brain over time. These changes can reduce the brain's resilience and make future episodes more likely and more severe. Not everyone with bipolar disorder experiences neuroprogression to the same degree, but the idea is important because it emphasizes prevention, long-term management, and lifestyle factors that may influence brain health, including exercise. So there are several biological processes that are thought to contribute to bipolar disorder. These include chronic low-grade inflammation, increased oxidative stress, changes in neuroplasticity, and impaired energy metabolism. So rather than focusing on exact molecular pathways, it is more helpful at this level to understand that bipolar disorder affects how the brain adapts, repairs itself, and produces energy. These disruptions help explain symptoms such as fatigue, cognitive difficulties, and emotional instability. So mitochondria are responsible for producing energy within cells. And it's interesting how mitochondria and bipolar disorder are tied together. And they are especially important in the brain, mitochondria are, which has high energy demands. In bipolar disorder, there is evidence that mitochondrial function is impaired, leading to less efficient energy production and increased vulnerability to stress. This can contribute to both depressive symptoms, such as low energy and slow thinking, and cognitive problems. What's really cool is exercise is known to improve mitochondrial function in many populations, which is one reason it has attracted interest as a possible intervention in bipolar disorder. So circadian rhythms regulate our sleep and wake cycle, and many physiological processes as well. In bipolar disorder, circadian rhythms are often disrupted, leading to irregular sleep patterns. These disruptions are not just a symptom, they can actually predict the onset of mood episodes. Because exercise has a strong influence on circadian timing and sleep regulation, this provides another theoretical pathway through which exercise might influence bipolar symptoms. So dopamine plays a major role in motivation, reward, and goal-directed behavior. In bipolar disorder, dopamine activity tends to be elevated during manic states and reduced during depressive states. This fluctuation helps explain changes in energy, motivation, and risk-taking behavior. Importantly, exercise strongly activates dopamine pathways, which makes it biologically powerful and potentially destabilizing for individuals with bipolar disorder. Pharmacological treatment is the foundation of bipolar disorder management. Mood stabilizers, particularly lithium, are considered essential for preventing mood episodes and reducing suicide risk. Antidepressants are sometimes used, but they must be prescribed cautiously because they can trigger manic or hypomanic episodes. Despite treatment, many individuals spend only about half of their time in a stable mood state, which is why additional interventions such as psychotherapy and lifestyle strategies are often considered. So, exercise has clear benefits for physical health and has well established antidepressant effects in unipolar depression. Individuals with bipolar disorder often have lower levels of physical fitness and a shorter life expectancy, largely due to cardiovascular disease. These factors make exercise an appealing strategy. However, the biological characteristics of bipolar disorder mean that exercise cannot simply be applied the same way that it is in other populations. So, exercise can reduce depressive symptoms, improve energy, and enhance cognitive functioning. At the same time, because exercise activates reward and arousal systems in the brain, it can sometimes worsen symptoms or trigger manic episodes in people with bipolar disorder. This dual potential is why exercise is described as the double-edged sword in this population. The behavioral activation system, or the BAS, regulates how strongly we respond to rewards and motivates goal-directed behavior. In bipolar disorder, the behavioral activation system tends to be overly stimulated or overly sensitive. During mania, it becomes overactive, driving impulsivity and excessive goal pursuit. During depression, it can be underactive, leading to low motivation. Exercise stimulates the BAS, which explains why it can either improve depression or contribute to manic activation. So when we exercise, dopamine release increases, and this reinforces motivation and pleasure. For individuals with bipolar disorder, this stimulation can be beneficial when dopamine levels are low, such as during depression. However, during hypomanic or manic states, additional stimulation of reward pathways can worsen symptoms. This is why exercise intensity, supervision, and timing are critical factors. So, research on exercise in bipolar disorder is limited but growing. Studies do not all show the same results, but they tell a consistent story when interpreted carefully. Exercise can be helpful, particularly for bipolar depression, but the outcomes depend heavily on how exercise is implemented and who is participating. Some studies show that higher levels of unregulated or habitual physical activity are not always associated with better mood outcomes in bipolar disorder. In certain cases, higher activity levels have even been linked to worsening symptoms, particularly when combined with other activating treatments. These findings highlight the risk of assuming that more activity is always better. Other studies, especially those using structured and supervised exercise programs, show promising results. In one pilot study, individuals with bipolar depression participated in a monitored aerobic and strength training program while remaining on their medication. Depressive symptoms significantly decreased, and importantly, there was no increase in manic symptoms. This suggests that exercise can be safe and effective when carefully prescribed. So, taken together, these studies suggest that exercise itself is not inherently good or bad for bipolar disorder. Instead, its effects depend on context. Structured, moderate, and supervised exercise programs, supervised exercise appears beneficial, while excessive or unstructured activity may pose risk. So, exercise for individuals with bipolar disorder should prioritize consistency, moderation, and flexibility. Programs should be adapted based on current mood state, sleep patterns, and energy levels. Protecting sleep and avoiding excessive stimulation are especially important. So, during depressive episodes, low to moderate intensity exercise can help increase energy and improve mood. During periods of euthymia or balanced mood, exercise can support overall stability and physical health. During hypomanic or manic states, exercise intensity should be reduced, and highly competitive or stimulating activities should be avoided to minimize the risk of escalation. Some key takeaways are that bipolar disorder is a neurobiological and progressive illness. Exercise targets several biological systems disrupted in bipolar disorder, including energy metabolism, circadian rhythms, and neuroplasticity. However, exercise is not universally beneficial and must be used thoughtfully. Its value lies in individualized, monitored application rather than generalized recommendations. The most important takeaway is that exercise in bipolar disorder is not about doing more, it is about doing it wisely. When integrated carefully with medical treatment and adapted to mood state, exercise can be a valuable adjunctive tool. When applied without consideration of the disorder's biology, it can become destabilizing. And as stated before, it's important to be flexible with clients with bipolar disorder. It, again, is not a one size fits all situation, and moods can fluctuate for any reason at all. So keep this in mind as you move forward as a future exercise physiologist, taking care of people across the mental health spectrum. So thank you so much for taking time to listen to this lecture, this brief summary of bipolar disorder and exercise. There's so much more to learn and dive into, and I'd like to let you all know that I did not come up with this material by myself. There's a lot of good research out there, and these are a few of the references out there that I relied on for this presentation. I encourage you to dive into more and get more information about this particular topic. Exploring mental health and neurobiology is super cool and fascinating. I enjoy myself in this area of research. And again, thank you. If you'd like to reach out with questions about bipolar disorder and exercise, I'm happy to answer them. If you have any questions about exercise physiology, I'd love to talk about that too, or any career pathways. My life is an adventure, and I love sharing with other people, and I'd love to hear about the adventures of future doctors, master students, doctors. Like the sky's the limit. I also have a YouTube channel. It's called Loving Exercise Physiology. Would love for you to check it out and maybe come up with some other topics that I can dive into. But this was a pleasure. I hope you enjoyed.